So we had a patient come in yesterday afternoon with a concern that it had been stung by a bee. And the reason for the concern is because the dog had been hiding in the backyard and didn't want to come out of the bushes. And when it did come out of the bushes, its tongue was sticking out of its mouth, which it normally doesn't do. And there was the perception that it was swollen. But there was no bee eyewitness, and there was no pain from the pet. No history of crying. When I examined the dog was very quiet. Its body temperature was low. Its pupils were very wide and poorly responsive to light, but it could see. It was not blind. It was lethargic. It didn't want to move. It just kind of wanted to doze off and sleep. But when it was stimulated, it had big jerky reactions that were disproportionate to any stimulus that it was getting. And when we put the dog on the ground, it kind of faded to one side and stumbled and walked back the other way. It did not have a stinger in its lips or tongue. It did not have any swelling. It did not have any hives. So I asked the owner, when was the last time the dog was perfectly normal? And the first answer was, well, it was hiding in the bushes. And I asked, well, what about before that? Well, usually the dog would greet the owner at the door and be looking through the windows and barking, but it didn't do that today. It didn't greet the owner at the door. It was very quiet and just went out to the backyard when let out to the potty. So while I told the owner it's possible that the dog was stung by a bee, I couldn't find any strong evidence of it. And I asked if instead, if it was possible that the dog could have gotten into any medication or any herbs that might have been at the house. And the answer was, well, gosh, no, I don't think so. So then I asked if it was possible that the dog got into any cannabis. And then the light bulb went on, and why, yes, that is possible. The dog could have gotten into cannabis. And so I offered that we could find out for sure by doing a test, because we can do drug screening tests on dogs and find out. But the owner didn't think that was going to be necessary. The treatment for cannabis toxicosis depends on how sick the dog is. The vast majority of the time, they're quiet, they're lethargic, they sleep it off, and in a day or two, they're fine. But it can be a couple days, because THC, the active ingredient, is stored in body fat, and so it's not that it doesn't just wash out of their system instantly. If a pet were to ingest marijuana within a half hour of being presented to the hospital, we might induce vomiting to get it out of their system. But it turns out that if it's been more than a half an hour, it's really hard to make dogs vomit that have eaten marijuana, because one of the effects of THC is it blocks nausea, which is why it's a popular drug among cancer patients who counter chemotherapy, because it gives them a solid stomach. So trying to induce vomiting seemed like it was not going to be very productive for this dog, since it wasn't normal when the owner came home, and the owner came home 2 hours before presentation. Clearly the dog didn't eat this within the last 30 minutes. So we didn't bother even trying to go there. Another way that you can try to clear cannabis from the system is with IV fluids. The last is activated charcoal. A few dogs that ingest cannabis, instead of being lethargic, they're agitated. It's about 25% of them. So they're still big-eyed, they're still ataxic, non-responsive, but they're jittery and they're hyper, to the point where some of them need to be sedated. So sometimes we give Valium to kind of calm them down so they don't hurt themselves, so let's say crash into things when they around. So that was the story of the bee sting that wasn't from yesterday afternoon.